So why would we validate? A number of reasons in DBT. One is to reduce negative emotional arousal. It works. If you really validate your partner, your spouse, your child, truly validate, drop the change agenda. That's partly what I learned at some stage in doing DBT. I realized there was a sea change in my grasp of validation. I realized to validate, I have to actually let go of thinking I'm trying to change the patient and just totally get it. And they know that I'm doing that, and they appreciate that. I'm going to reinstate the change agenda later, but I need to drop it and say, okay, like this teenager I've talked about before, so if any of you have heard of this girl that was brought into the hospital, 16 years old, after being apprehended by the police on top of her family's roof, where she had her hand on their TV antenna, and she was swinging around at full voice, singing all the songs to West Side Story. And she's yelling it, and neighbors see her up there and hear her. They're terrified. They call the police. Police come, get her down, take her to the hospital. So she's in the hospital, and I do the interview. And I do a behavioral chain analysis of how this came about. First out, what is valid about this behavior? Well, it turns out that her parents were having a knockdown, drag-out fight in the house. And she went outside, and they had had a lot of chronic fighting, and she didn't know what to do about it. And she went up on the roof, and she's swinging around. Of all things, she's singing, of course, the songs to a play that's about a gang war. I don't know if she thought that clearly about that, but I thought there was some sort of beautiful poetry in this situation. And she's screaming these songs and singing them, and then she comes to the hospital. And so it was valid in one way, in that it got her out of the house. She agreed it was valid in another way, is it got her in the hospital, which she appreciated to be out of the house. And it was valid in a third way, in that it brought attention to her parents' relationship and her situation of being trapped with it, so that maybe something different could happen. And by asking her those kind of questions, she said yes. Yes, yes. I don't know if that's what I was trying to do, but I'm glad it happened. So, you really search for the validity. Now, on the other hand, I don't want to validate that she was doing that, because validation might reinforce her. So I want to validate the impulse to do that. I want to validate that that made a lot of sense in retrospect, but I never want to see her do that again. Because if you validate something that's a problem behavior, you might see it again. You want to counter habitual self-invalidation. This is especially true with borderline patients who have grown up getting used to invalidating their own point of view, mistrusting their own feelings, looking to other people to see what to think and feel. And so you want to validate their urges, actions, emotions, so that they start to get the idea that actually they have the capacity to have valid responses. To teach self-validation, so you teach somebody how to validate themselves by validating them. And to strengthen the bond with the client, because validation, if it's accurate and if it works, it strengthens the bond. Feel like you're in it together. Strengthen the client's ability to problem solve and to strengthen clinical progress. So it has a lot of functions in it, and I'm teaching it second after change procedures, because the way I want you to think about DBT is you are just the way Linehan developed DBT. Started out as a CBT, change-oriented therapy for suicidal behavior, and then it sort of draped validation into it to make it work. And then it turned out it's even more valuable than that. It doesn't just make the change things work, it has its own power to affect change itself.